when you have achieved the things you wanted.
Exactly.
You have your clinic, you maybe have your family, you have your house. And when you realize that you're not happy there, that is a scary place.
Anything that you want to be aware, that you want to control in life, or to make your life easy, is you need to be aware.
I don't know how many times my husband said to me, why don't you go and sell ice cream instead if you want everybody to like it?
And this is a very harsh thing to hear, is that you will say things that will sometimes hurt other people, no matter how careful you are in telling them, no matter.
We have to go through the mud to be able to bloom.
After 2 burnouts in dentistry, I asked myself, what if I could turn my struggles into stepping stones for others? That's how this podcast started. We learn from each other, going from stress to success. And with more than 60% of dental professionals facing stress or burnout, this conversation has never been more important. Let's get started.
I'm so happy to see you again here because you and Manuela were one of the first persons who really helped me find my success. And what I mean with success is having a life that is aligned with your values and purpose. So I thought I was on the right track, but I was just fooling myself. I was not really aware and true to myself. I didn't know. I was just on a path towards a goal that I had set like 20 years ago, and I thought that was my goal.
Yeah, very common.
But there was one thing that you said in the podcast. Okay, so I will start to say the first time we met was on your leadership course in Sagres in Portugal. And by the way, that was the most beautiful sunrise I have ever seen in my life. Oh my gosh. So for all the listeners, you have to go to Sagres in Portugal. That is amazing. And then your course was amazing. One of the feelings I got there was that I wanted to be where you were and not in my clinic. So sometimes we go on a course, but we realize things that we didn't expect.
Yes.
The second time we spoke was when you invited me to your podcast and you asked me a question that I didn't expect. You said something like, Christina, do you feel that your creativity can be expressed enough in dentistry? And I was like, it felt like, no, it's not enough. But you surprised me there, and I surprised my own reaction. That was, I think, in August, end of August. And I got my second burnout November. So it was like September, October, November. 3 months after our podcast, I entered a burnout that led me to almost like a depression. Because what I really wanted was not aligned with my life. So I want to thank you. It was a difficult phase, but I think we have to go through the mud to be able to bloom. And that's why the logo on this podcast is a lotus flower, because a lotus flower grows from the mud and then it becomes a beautiful lotus. So please tell us who you are.
So first, let me thank you for, it's always inspiring to see that people change their lives or try to look for their own happiness. And for me, it's really, really a pleasure to be able to have helped that. Actually, I think that deep down you knew there was something that you needed to change, right? And sometimes you just need the spark to make things happen. So I'm very happy for that. And I completely understand what you mean, because I do feel the same. For example, actually, you are probably one of the first persons that I'm going to tell this. I've pretty much achieved in dentistry whatever I wanted to achieve in terms of publications, speaking at congresses, and traveling. And I am at this point in life in dentistry that I'll be probably be selling my practice. Not like I will not be stop teaching dentistry or even working in dentistry, but I will. There are a lot of other things that I would like to focus on, like apps and techs and stuff. So yes, I completely understand what you mean, and for me, it's like, okay, so I reached a point in dentistry that. It's good. It has been good, but I feel like I want something else. Yeah, and so it's maybe a different path, but it's at the end of the day, I think that you need to really be aware, because it's all about self-awareness. You need to be aware of what's going on inside you and make the changes that you need to do. Now, talking about me, so I entered dentistry. Actually, I wanted to go to medicine. And I entered into dentistry. At the third year, I had the possibility to change to medicine. Then I started to think about the fact that I wanted to have my financial independence as soon as possible. So I thought, oh, if I go into medicine, I'll be studying 6 years plus 6 years. By the time that I'm good enough to make some money to be able to do my own things, I will be like 40 or 50, right? Because it takes a long time to be like a specialist doctor. And I said, well, this is too much. During that summer, I was also watching some dentists, and I was just shadowing some dentists. And I realized, actually, this is quite interesting, because I always loved the artistic part. I was very good at drawing, and I also was in doubt when I was in high school whether I should go to design or architecture eventually, or health, because my heart was like split between dentistry and healthcare. So I said, well, this can be a good fit. And it was a very good decision that I had, because if I had not chosen dentistry, I would never be able to have the freedom in my life that I have now, because dentistry has a lot of issues, as we will talk. We have a lot of dentistry is like, it can be a really, really dangerous profession, as you know, and we'll talk about that for sure. But it also has a good side, which is it's mainly private practice. So it means that you have the freedom to implement the kind of life that you want to have. And I was very lucky to, maybe in the first 5 years of my career, someone really explained me, look, these are the dangers of dentistry, and you better watch out. You better take some actions right now if you want to have dentistry working for you in terms of providing you the life that you want. So I'm very happy for that. And after maybe 10 years of dentistry, I started to do a lot of courses. I love teaching. I started to write articles. It was one of the reasons why I opened my own practice in dentistry, because I wanted to have control over the environment, to photograph the case and to write articles. And then I realized, and this is probably the most difficult part in dentistry, and what made me start the Soft Bite podcast and start to talk about these things, is that, so I wanted to have a practice that could work, that could give me the support to be able to do courses, because you want to document cases. I want to have a practice to be able to give me 1 month, 2 months, or 3 months of vacations if I wanted to have in 1 year. And for that, if you want to have that kind of practice, you need a team, right? Mm. And this is where things get messy. You know, it's, if you are a good technician, everything goes well. The problems start once you hire a team, because humans are not easy to deal with. I mean, we are not easy to deal with, and you have to navigate through all this environment that dentistry creates, which we know it's very stressful. It can be very stressful. So I had to do a lot of work. I had to think a lot. I had to sit down and write a lot of things and systems and try to see what was the best way to organize a clinical practice to work for you. And it's very difficult. It is really, really difficult. Just like any small business, it's difficult. But on top of that, dentistry has some particularities that make it even more difficult. And yes, after 20 years of 20 years of my practice, so I've been practicing since 20. So I've been practicing 23 years now, and I opened my practice. Is going to be the next day, actually 28 is going to be 20 years that I opened my practice. And after this time,
so you had been a dentist for 3 years when you opened your practice.
Yes, exactly.
Yeah, wow.
Yeah. And that's it.
Before I forget, there's another thing that reminds me of you. And I say this very often because that thing that you said stayed forever because it's so spot on. I don't know if it's exactly the way you said it, but you said something like, if you think of a colleague more than 10 minutes, yes. In the evening when you're at home, there are two options. Or you have a relationship with that person, or you're thinking about that person, or that person has to go out from the team.
Yeah. Yes.
Could you explain that?
Well, it's a sentence that I heard from a guy that really changed my life. His name is Alok Shukla. I was actually spending the weekend with him. He is with his wife living in Portugal now. But basically, when I started dentistry, I went to King's College in London to do a master's degree, and I met this guy that he made the opposite decision. So he was in medicine and he came to dentistry. So it's very funny. And he told me one thing. He basically introduced me to what at the time was self-help, something very strange, like psychology books and NLP and management and marketing. It was completely different from my nerdy part. I was very nerdy in terms of dentistry. And of course, when I opened my practice, I started to struggle because when you open your practice without any kind of notions of management, you can really burn. Dentistry is a very dangerous profession if you don't know what you're doing, especially if you have a practice. And he told me one thing. He said, look, André, if you go to bed at night and you think more than 30 minutes in bed about one person.
It was 30 minutes.
Yes, you either have two options. Either you're already screwing them, you have like already an intimate relationship with them, or they need to get out of your life, because otherwise it's just a waste of time. So either you are in a relationship or you want to have a relationship with that person, or there's something wrong and you need to think about exactly what's going on. And dentistry is very dangerous for those kinds of things to happen, because another thing that he said, which is very interesting, is dentistry is a bunch of scared people closed inside four walls with a bunch of people with sharp instruments. So it's a recipe for disaster. So patients are afraid, there's sharp instruments, there's drama in the team, there's stress in the team for time, for this, for whatever. So it's really a recipe for disaster. I don't want to be too pessimistic for the people that are listening, but I think a good thing that we need to understand about anything that you want to be aware, that you want to control in life, or to make your life easy, is you need to be aware of the situation. And this is not about being pessimistic. It's, look, dentistry can really, really make your life a mess if you are not aware. And the worst thing is that sometimes you reach your 40s, you reach your 50s, and you look back, actually, what have I done? What is this? What is the kind of life that I lived in dentistry? Because it's just a rat race if you're not aware of what you're doing. It can be very dangerous.
I totally agree with you that self-awareness is the crucial thing. Everything starts there. Everything. Because that's the pattern I have seen as well with when I have compared the dentists who, you never know what's behind the scenes. So I'm not saying nobody has a perfect life. I'm not saying perfect, but the dentists who have seemed to find some kind of happiness in the profession, or some kind of happiness and harmony. The difference there is that they are self-aware. They know what they want and they keep on that track.
Yes.
I was the total extreme. I always loved psychology. I thought I was good and self-aware. But at the age of 45, I realized that, I don't know if you have seen it's a short video of Jim Carrey.
Mm-hmm.
When he says, depression is when the avatar you have created says, fuck you.
Yeah.
I'm tired of being the avatar you created. Like you,
Yes,
and
it
that's
is.
a little bit like, and often it comes when you have achieved the things you wanted. You have
Exactly.
your clinic. You maybe have your family. You have your house.
Exactly.
And when you realize that you're not happy there,
Yeah.
that
There's
is a
something
scary
wrong.
place, because it's like, what do I want then? Who am I? And it's all about self-awareness. And one theory I have, first of all, I think self-awareness comes from our childhood. The first years of our childhood. So if you have had a childhood where you have been able to express your feelings and your feelings and thoughts were respected, and you had that space to tell and feel what you really want, that is very important and
Yes.
important ground to stand on. But then when you enter dentistry, dental school, it's 100% focused on the patient. So if you are not self-aware from the beginning, for example, as I was, and you enter a profession that's based on the patient, you're totally screwed, because you're totally focused on everybody else around you. And you get lost there, because it's a game you can never win.
It makes a lot of sense what you're saying. It makes a lot of sense. And it's, the problem is that this is way more common than we would like to admit, isn't it? I mean, many people go to dentistry because of the financial freedom, because of the schedule freedom, because of the prestige of the profession. And it can really be very dangerous. Well, I think that for me, I completely agree with you. I think your experience during childhood has a lot of influence on, of course, on your intimate relationships, which is to start. It has a huge influence, the relationships with your father, the relationships with your mother. I used to believe that we had much more control over that, over those patterns, but actually, we usually end up in relationships that can really spark, that can really ignite our reactivity, and for sure it has a lot to do with patterns that during childhood. And I never thought about what you are thinking, which is, if you have the opportunity to express yourself and to know yourself and to know, and I would say to feel, to have the space to feel what makes you happy, right? If you have that space to feel what makes you happy during childhood, I think you'll be having a much clearer vision of what you want to do in your profession. And if you have that vision, you know the limits. I mean, so dentistry can really take you off track. And if you are self-aware, you can be able to say, no, this is not exactly what I want to go. And the problem with dentists is that we often like to be liked, right, by patients. I used to say that in the first years of my professions, I wanted patients that fall in love with me. I wanted them to fall in love with me. And why? Because I wanted them to say like, that, and that comes completely out of insecurity, right? Because in the first, I would say, 5 years of your profession, you want to prove something, right? You want to prove that you are capable and you are extremely nice. You create this amazing environment for them. And I remember my goal was that when they left, they would say, this guy, I will never leave this guy, because this guy is the most charming dentist ever. And that is good. I mean, that's this. There's this false sense of success, because the problem is that when you want your patients to love you, to fall in love with you, when you want to seduce your patients, right? Of course, in a professional way, but when you want to do that, what happens is that you will be paying the price for that. It's because they will not leave you. And if you ever refer them to someone else to do the endo or to do the ortho or to do the perio, they will have a lot of resistance. Even within the same building, even within the same practice, they will have a lot of resistance. And
you realize that you're handcuffed. You realize,
absolutely,
yeah.
Yes. And that is
a common problem as well. Yeah.
Yeah, that was that was the most difficult thing in dentistry, and it still is. Because today, for example, I still treat some of my older patients that sometimes they are friends, or I just like to talk to them, that I do some general work. And now I'm in a point that I'm thinking about selling my practice. And I may even still be working there and still doing some management and stuff. But I will need to go through the process again of saying, look, I'm not going to see you again. And this is very difficult. Why? Because I made them fall in love with me in the first years, right? And it was the most difficult part of my life in dentistry I would say when I opened my practice around 6 years, when I had to tell my old patients that helped me grow my practice, so these are the patients that help you grow your practice. Now you're going to tell them, look, I will not be able to do the control appointments or the endo or this. Oh, but you did it in the past. Oh, I know, but you're good enough to. And for me, it was the most difficult thing in dentistry, because it seems like a betrayal, right?
Yeah.
It seems like a betrayal, and it's that thing that you need to care about other people. You need to care about the patients, but also at the same time, you need not to care about what they think of you. And this is the most difficult balance that you can do in dentistry. So it is very important to be aware from start to know exactly what you want. So, and one of the things that I do today, and this may sound silly, I make an effort not to be excessively nice with them.
Explain that. How?
For example, sometimes I would say that 90% of the patients that go into my practice, I don't know them. Because I've made sure that I was never the one that did initial examination, which is like a big trap. You want to be the rock star of the practice, right? And being the rock star of the practice is the most dangerous thing of all, because it's not sustainable. And then everybody wants the rock star. And if everybody wants the rock star, it means that you will not have free time, right? That you're a prisoner of the practice. So once I started to be a specialist inside the practice, I want to make sure that I am not excessively nice with them. I don't want that my ego comes up to say, look, I'm better than all of these guys that work here. I have to because when you are very confident on your work, I mean, you are very charming, right? And even if you don't say anything, people feel the energy of confidence and security and, let's say, masculine energy, whether you're a woman or a man. And I'm always very aware of that. I don't want them to fall in love with me, because what happens then is that I'm sabotaging the whole practice. I want them to realize that the practice itself is what they should be in love with. What is the practice itself? The system itself. So the practice is the hygienist, is the endodontist, is the periodontist, is the implantologist, is the orthodontist. So this is what they should be falling in love with, and not with a single person. And this was the most difficult thing for me to deal with. And today, of course, I'm not rude with the patients, but I don't want them to fall in love with me. I don't want them to believe that I'm the rock star. I don't want to be the rock star of the practice. And I think, looking back in the first 5 years, if I had this notion, and it's very difficult to look back and say, I would have done this and that. But the problem is that in the first 5 years of your profession, you are extremely insecure. And when you are insecure, you come out as needy, right? And you want people to like you, right? And this is something that if I was aware today, I would probably do things different. For example, practical thing, I would probably start working with an oral hygienist as soon as possible. So the relationship is mainly with the oral hygienist. I don't want to have a very personal relationship with the patient, so that they understand that the practice is more than me. Because in the beginning, I would do everything: endo, prosto, restorative, everything, and it's oral hygiene, and this can be really dangerous if you are thinking about opening a practice. And it sounds easy, but it's very difficult, because when you open a practice, you need to be the rock star. There's not another choice. You are the rock star. But the way that you communicate with the patient should always be in a sense that, yes, this is a practice. I'm here now, but the goal is to be a team, and this practice is taking care of you. It's not like I am taking care of you, which is something that we usually do in the first years of the profession. And that was by far the most difficult thing in my career, having to deal with that paradox.
Yeah. It's really complicated, because you go through these different phases. Like you said, you're insecure in the beginning. You want them to like you. You give extra value. If you have your own practice, you want
and then they fall in love with you.
Yeah.
How many patients
then you realize that you want to have space. It's like a relationship. No, I need my space. I can't be there. But you were taking care of me all the time. So it's just like you said. I think that if you're opening a practice, we should all have, just like we have a driving license, we should need a license before we open a practice to learn all these things, because I think that's a mistake that 99% are doing. You're doing your brand, you're building your brand, and that brand is connected to you as a person. And that is the biggest mistake. And then you want to have space, and then you risk to lose patients and have patients that are not happy with you. But I think to be able to achieve that you said, that they will fall in love with the practice, everybody in the team have to have the same values, the same core and treatment and vision.
Yes.
So they feel that it's duplicated. Doesn't matter who they go to. They feel the same or similar.
And that is another big challenge. The question is that possible? Is that even possible? Right? Because, so we came to the conclusion that the dentistry cannot be the practice cannot be relying on the rock star, right? That's obvious, because that's completely a disaster in the long term. So, let's look at the other way. How do you gather a team? In the beginning, it's difficult, because how big of a team can you gather if you don't have money to pay them, if you don't have enough patients to pay them? So in the beginning, I think that you should, of course, start to do everything, but as soon as possible, even if it is financially difficult for you, I will start working with an oral hygienist, eventually an endodontist. So it depends on the things that you want to do. With an orthodontist, I think you need to have start to think about the vision that you want for yourself, and it can be very different. And it doesn't mean that, for example, today you want to be an orthodontist, and after 5 years you want to be an implantologist. There's nothing wrong with that, but just be aware that you need to gather a team, and the team is much more important than you. So it's difficult to do that. Initially, you need to abdicate of some of the financial freedom that dentistry is going to give you, because there are patients that you could be making money for yourself doing the endo, but you will be having to refer them. So you have to think about all these things. And the reason why you have to think about all these things is that, and I'm sure you still remember practices that were referral practices, for example, referral for endo, referral for ortho. those used to happen much more than they have now, because the problem is that today, it's not a problem, is that every practice, even if it's like a solo, even if it's like a practice with only 2 dental treatment units, 2 dental chairs, very likely that practice has an implantologist, a periodontist, an orthodontist, a pediatric dentistry. All those specialties are coming together, even in small practices. So what happens today, what I see in dentistry, is that even small practices, they have a lot of people working there. Why? Because dentistry has become so specialized that you need to work as a team. It's very difficult for you to do everything. Okay, yes, you can do restorative and you can do some minor ortho, but for example, if you want to do oral surgery and bone regeneration, it's difficult then to do an endo in between those appointments. So you need a couple of people. You need maybe 3, 4, 5 dentists, even in small practices, to come even to see some specific cases. So if this is happening and you cannot do a single rock star dentistry, and dentistry is going interdisciplinary and you need to have a lot of people working with you, now the question is, how do you coordinate all these people? And this is also a problem, which is, and that I find, and I really found that myself, and I see it all the time, and it is the most difficult thing to make dentists understand, which is you will have to be able to say no and set boundaries and make sure that things happen as you want or as the team wants them to happen. Let me give you an example. This is very typical. So a patient comes in for initial examination, right? No matter if you have an initial examination or if you don't have, so someone does an initial examination. And this patient, a very typical patient today, 40s, someone in their 40s. They miss some teeth, they have crowding, they have some gum recession. So they need implants, they need some perio, they need some ortho, and then some veneer. So maybe 3 to 4 dentists are going to work on this case, right? And even in the small practice, this is very common. And why was this not so common 10 or 20 years ago? Because 10 or 20 years ago, adult patients, they would not accept braces, but now you have aligners. Patients were not aware. Patients were not so driven by aesthetics. Patients today, they have the first life, then they divorce, they have the second life, then they divorce, and they have the third life, and they want to keep looking good and fresh and healthy for a lot of years. And people in their 60s, they want. Today you have people in their 60s that look like people in their 40s, maybe 20 years ago. So if this change is happening, if this wave is coming, and it's coming to get you. This means that you will have patients in your chair that will accept treatments that involve ortho, perio, prosto, and implants. And they accept this. You propose them, good treatment plans or bad, it doesn't matter, just propose them, and they say yes. And now the problem starts. Now, you have to think about things such as, how am I going to gather the whole team to be working on the treatment plan? I mean, but the orthodontist is a moron, he's an idiot, he doesn't answer to emails. Or the periodontist is always full and he doesn't like to do meetings. So you will have to be able to make these people communicate in between them. And I think that a lot about this. For example, let me give an example. So some people say, well, I'm going to have them here, and 1 hour a week, we are all going to come together to talk about the treatment plan. It's never going to happen. Never. It is never going to happen. Because today, the pace is so big, you can say, well, but they are here full time on my practice. Try that. So try that. My experience is that is not going to happen. Okay, so let's make it easier. Let's make it like once a week, 1 hour after work, we'll go all online. Still, it's not going to happen. It's very difficult in today's age to get together 4 people to stay together for 1 hour.
In dentistry,
it's impossible.
I think what you're, sorry for interrupting a little bit here, but what you're saying think, because looking back, I was like, why did I do veneers? Why did I also do Invisalign? Why did because of that. I was like, okay, if I do everything, I have control. But it also gives you more problem because you're the rock star that has to be connected all the time.
It's a complete illusion. So the other option, and for me, this is the only option, is to communicate on what we call a synchronous way. So they don't need to be together at the same time. So someone collects the data, someone sends to the other colleagues the data. So we have this, let's make a treatment plan, and we want to present them in a decent amount of time. So if someone comes to your practice and gets some data collected, it's reasonable to be able to present a treatment plan in about 2 weeks, right? But if you are not careful, some dentists, they can take 3, 4, 5 weeks. And from a patient perspective, from a service perspective, makes no sense. So the only way is to make sure that by email or by some sort of communication, you can all come together and gather a treatment plan. It doesn't need to be ultra complex, just keep things simple. So I'm thinking about this for ortho, this for implants, in doubt, just make the prices slightly higher to make sure that if something happens, and then present a treatment plan. Now, the question is to create a team that can actually have people that open an email or open a message and get back to you. First of all, to send an email that is clear and objective, and then get back to you on time, and then create a treatment plan that is common and that then is presented. This seems very easy, but it is very difficult because today the focus of people is all over the place, and this is very difficult. And how can you make sure this happens? Sometimes you need to look like an asshole to other people, and that is the most eye-opening thing to me, because in order to be able to create a system and make sure that system is working, you will need to be able to tell people, look, this was wrong, you need to correct this. This was wrong, you need to correct it. And today, I think that we are not used to have a culture of, and I think that discipline is not a good word, a culture of efficiency. Because today, efficiency there is a big confusion between efficiency and sympathy and politeness. So just because you are being polite and just because you are being cool, it doesn't mean that you're being efficient, right? And the problem is that people focus so much on politeness. People focus so much on being careful by the way that you treat other people and so on, that they forget that the most important thing in a practice is, of course, respect. You need to have respect. You need to have a good environment, but you need to have efficiency. And another big sentence that really changed my life was this: you have to choose one of two things. If you are either liked or you are efficient. You cannot be both. And I know it's a very controversial thing to say, but I think that once you reach a team of 5, 6, 7 people, and this is a very harsh thing to hear, is that you will say things that will sometimes hurt other people, no matter how careful you are in telling them, no matter. And this will happen. And for me, I think this is the biggest dilemma of leadership, is that you will have to be confronted with the fact that saying things to people in a very polite way, it is possible. Okay, so let's imagine there was a procedure that someone didn't do, right? So first of all, it should be written as much as possible and rehearsed and so on, but there's always going to be mistakes. So if you don't treat patients, you will be having a state of mind that you talk to them, look, I mean, this could have done better. Okay, so let's see if we can do this better at the time, and make sure that you don't arrive late because it's difficult for patients. And please make sure this happens. But the problem is that you do a lot of other things. And when you ask someone to arrive on time, you have already seen 10 patients in that day. Some of them very difficult. And the way that you are going to talk to the person that is arriving late, it's not going to be as aware and as polite as you would like to, because guess what? You're human, right? And humans, we do a lot of mistakes. And when we talk to people, sometimes we come out as very harsh, very arrogant, and very unpolite. And if you think that in dentistry or in any sort of leadership role that you are that you are in, that you will never do these sorts of mistakes, you are wrong. And this is why big companies have human resources departments. Human resources are just Zen people that listen and listen and listen and listen and want to see what's the best fit. But that's the only thing that they do. They don't actually work. The problem is that you are working, you are seeing patients. And I don't know if you agree with me, but dentistry, you really absorb the energy of patients. And you are not aware of that, but there's so much energy that you absorb.
You're speaking with, I think, the biggest energy sponge there is.
And the problem is, then when you have to talk to your nurse or to the doctor that is arriving late, or to the doctor that doesn't get back to the emails, or to the doctor that you know it's creating drama, when you are going to talk to them, you are not in a good position to talk to them because emotionally you are triggered already. So I think that first of all, you need to accept this fact that you will do mistakes, and it needs to be part of the culture of the team, is that, look, I am not perfect, and sometimes I will be talking to you or doing things that you don't like. The way I do it in my practice is that we have financial fines. So if they do some mistakes that have been written and that have been rehearsed and that everybody agrees on with the meetings, if they do mistakes, we fine them financially, and with that money we go out to party, or we give to a charity or something like it. And this is the way that helped me. But it's difficult. Why? Because I think that we live in an age today where when you need to call out someone that they didn't do the work that they were supposed to do, this needs to be done in a very, very ultra polite way. But it's just not possible, and you will do mistakes, and you will need to tell them, look, I'm sorry about the way that you talked to you yesterday. I think it was not very good. But if you have this openness, if the practice understands that this is the culture, that sometimes that we are all responsible for things that we do wrong, and we will have financial fines for this, and this is normalized, I think that you are in a very good place to move forward in management. If, however, you have the opposite, which is we are all family, we all treat each other, we all want the best, and it's true, we all want the best from each other, but sometimes we need to have tough conversations. And I think this is one of the things that I see, even for myself, even today, is something that is difficult for me when I have to find someone. And this thing, it really eats you from the inside. If you don't make this normal, if the team does not understand that sometimes you will be having to say things that they don't like. Of course, there need to be rules. You're not going to just embarrass someone in front of everybody, but you need to be having difficult conversations. So if you want to create a team in dentistry, be ready to have difficult conversations and be ready to fail, be ready to sometimes be offensive for some people. They will feel offended, and you have to be able to navigate through all that. There's no other way. Yeah.
I totally agree with you, and I think what you're saying is so important that we should have this pretty early in our dental education. Because of the complexity of our work, we will be as a dentist, we will have both patients and our team that we have to be good leaders with. And I don't know how many times my husband said to me, why don't you go and sell ice cream instead if you want everybody to like you? Because that was my big problem. And that will affect your patients, your staff, everybody. And you're not a good leader. You're not a good dentist if you just want to have this, if you can't have difficult conversations. And I couldn't. So it's very important to teach
By the way,
students.
By the way, I still have struggled a lot of having difficult conversations. I still do.
It is difficult, but again, it starts with self-awareness. So because that I modified my career and I'm now working from home, I went with a therapist to deal with my my people-pleasing tendencies, because having a difficult conversation is like, why is it difficult? It's difficult because you want to be liked. You don't want to feel rejection. You have to go to the core. Why is it difficult? That's the thing. Because you want to be liked. So what happens? You have to accept that feeling that I'm not liked. And if I could turn back time, I would definitely listen to what you said. Like, if you think about somebody more than 30 minutes, or it's like, that person probably doesn't fit in the team.
Yeah.
And skills you can teach, but not attitude or personality. Of course, you can change, but it's not easy to change a whole personality, a person. We know that. With the right attitude, you can change. With the wrong attitude, it's not that easy. So hire slowly, fire fast.
Fire fast, yes.
Yeah. What do you think about that?
I agree. I completely agree. And I don't want to look like I know all the truth, because I still struggle with these things. For example, let me give you an example. I was hiring a new nurse, and this is the third in 2 months. This is the third, right? It is difficult. It is very difficult. For example, I had a situation recently where I realized that you would say things to the person. Actually, I would say you would write, which is a very important thing. Things should always be written down. So these are the working conditions, this is your time schedule, and so on. And she started, and after 15 days, she was saying, oh, can I just come home earlier on Fridays 2 hours because I have a kid with special needs, and I can eventually compensate for that. And I was like, it's difficult to do this, because, okay, you have a kid with special needs, you have never told me about this, and now I'm going to have to tell the other 5 nurses that, look, this person is now going to have some benefits, more benefits than you. Okay, they don't like that, the other nurses, but also this person has a kid with special needs. And you see how difficult this is, because, okay, so this person has a kid with special needs. No, she never told me about this condition. She accepted things. And now you will have to deal with the fact that you will be, because, for example, in Portugal, you have 3 months to test the person to see if he's a good fit. So, and I told her, look, I completely understand. I really wish that I could help, but your situation, which I'm very sorry, and I know it's very difficult. You are a single mother. I realize that. She told me, I'm a single mother with 1 kid with special needs. And yes, you have a situation, but I have 10 families that depend on me. And this can really be heartbreaking for a leader, you know, because no one is as cold to a point that you will have to let down someone that is a single mother with a kid with special needs. You see, it's difficult, you know. But at the end of the day, I think you need to have, okay, so what is the best for the team? It's not even about yourself, The best for the team is that this cannot happen, because this will create a lot of issues, because no one has these opportunities here in the practice of leaving on Friday at 4 p.m. It's not possible. But at the same time, you have this person that is, okay, she hid it from you what was happening to get a job. And these are the kind of things that really they eat you from the inside, right? And then when you realize, look, how have I became such a cold person, you know? I wasn't like that. Do you understand?
No, but I don't see it. No, I have to correct you. It's not about being cold. I totally agree with you. And again, I would like to repeat what you said about writing down. And here is a situation that you could write down all your feelings for yourself. What did I feel? First of all, I didn't sign up for this. There were information that I didn't know from the beginning. Another thing is that, is this something that will disturb me, that will affect me and the team? Yes or no? Yes.
Yes.
So that will be like a thing that will disturb. And if it is one thing that I have learned in life, because I try to fool myself in so many situations, and you can never fool yourself. That thing that will disturb you will be there, and it will show up somehow in an illness, in stress, in words, but it will not disappear. If it's there disturbing you, it's better to clear it up as soon as possible. And I don't think it's about being cold. We have to be true to ourselves. By being true to ourselves, you can be a better person towards other people. And sometimes we can't understand our feelings. It's like, this thing is disturbing me, but I'm respecting myself. Because, you know, one thing, a feeling I got when I was burnt out, I got angry on myself for disappointing and not listening to myself. The feeling I got there, like, how come I have come to a point where everybody else's feelings are much more important than myself? And I promised myself, this can sound strange, but I promised myself, I spoke to myself, Christina, I will never disappoint you again. Yeah, myself. And that is what we're doing when we are not listening to ourselves. Like, something is disturbing you or your team. You have the responsibility of your team, like you said. You're feeding 10 families. And that has to be solved somehow. I don't say it's one way only, but it has to be solved, because if you just push it away and think, no, I'm just going to be kind in this situation, somehow it will show up.
But for people pleasers, like I am a big people pleaser. I'm much better now, but I think I've always fitted in that category for sure. And you mentioned that you were as well. Don't you find it takes you so many years to realize actually other people's feelings were always above my own feelings, isn't it? Yeah. And it's so strange. I mean, and then once you realize, well, this is obvious. Why haven't I talked to myself? Why have I not considered myself as important as other people?
You cannot see it because that was created when you were a child. Yeah. And it's not about complaining, because I think every parent tries to do the best.
Of course.
My parents have done their mistakes. I am doing my mistakes. You know, that's life. We're just trying to do our best. But those tendencies are created in our childhood. So that's the way your brain works. That's the way you got reward. Because everything we're doing is about reward. So when you're pleasing somebody else, that gives you dopamine.
Yes.
I have a value now because I'm pleasing you. Changing that. Yeah.
Yes. No, I was telling you that when you do that, actually, I made a new friend. There's someone here that likes me. And therefore, I feel important. And it's completely true, because the importance that you were seeking for was actually importance that that eventually was never eventually expressed in childhood or something like that. Yes. But what I find funny is that it takes, once you overcome that with age, with experience, with mistakes, with drama, with going down, or for example, just like a relationship, because relationships can also bring that up in many ways. I think the relationship of leadership, when you have to lead 5, 6, or 10 people, you all those things will come up. All those things will come up, and you will do mistakes. You will lose your temper, and I think that really going through that, and then being on the other side and looking at how for so many years I've tried to make others' people priorities more important than mine, whether in a relationship, whether in a team, and it's very difficult for people that are people pleasers to understand that. Yeah. It's very difficult for them to see. It's unless they do some work, and this is why I'm a big fan of therapy. Yeah. I just love therapy. I think it's something that everybody should do, because. Yeah. When you are in therapy long enough, and of course some people may need few sessions, but some other people may need to be in a more continuous basis, to have someone in a neutral way say, look, actually, you know what? You need to be more rational about this, and you are not seeing the things as they are. You are seeing these things as your heart and your brain sees them, and just wait, stop, and think about this. Does it really make sense what you're thinking? So, and for me, dentistry, when you enter into dentistry by accidental, basically you become a leader by accident, right? Because that's what I like. If you open a practice, you will become a leader by accident.
I wish I had a Smiler when I had my dental practice. It removes so much stress from the dental team, handling online bookings, patient questions with a chatbot, pre- and post-treatment automations, and even offering a marketplace for dental treatments. Smiler isn't just a sponsor, it's a solution. That's why I love working with them, because they take dental teams from stress to success. If this episode helped you, don't keep it to yourself. Like, comment, and subscribe. Not for the algorithm, but to help more dental professionals go from stress to success. Your support means the world. See you next time.